Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Bonjour tout le monde et bien.
Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Our speakers today are the Premier, Blaine Higgs, and the Chief Medical Officer of Health, Dr. Jennifer Russell.
On behalf of the province today are the Honourable Blaine Higgs, Premier of New Brunswick, and Dr. Jennifer Russell, the province's Chief Medical Officer of Health. Premier Higgs.
Good afternoon. Bonjour. Our hearts are with the people of Nova Scotia today as we all try to process the tragic events of this past weekend that left so many families grieving and many others injured from a senseless act of violence. Je sais que tous les
I know that all New Brunswickers join me to offer their most sincere condolences to our neighboring province, as well as to the friends and families of all of the people who are affected. Nova Scotia and New Brunswick are so closely connected.
Many of you have loved ones in the province. We are much more than neighbors, and today and in the days to come, we grieve with all Nova Scotians. I have been in contact with Premier McNeil and have offered our sympathies and support. As well, flags have been lowered to half-mast at the Legislative Assembly and across the province in honor of those lost. A tragic event like this shines a spotlight on the courage and sacrifices of our frontline workers and first responders. The RCMP lost one of their own over the weekend, Constable Heidi Stevenson. As well, another officer was injured. Our thoughts are with them and their families, as well as each and every person lost in this senseless tragedy. Malgré les défis,
Despite the challenges connected to COVID-19 and the tragedies like that of this weekend, our police officers continue to serve and protect our communities.
the names of the other victims will be released in the coming days. They will all be mourned, as each loss is profound. At times like this, we want to gather close with people we love, to see firsthand that everyone is safe. Unfortunately, many families are apart right now as we work to contain the spread of COVID-19.
I encourage you to get in touch with your loved ones, either online or over the phone, and to find ways to stay connected even if you are apart physically. The challenges we are facing now, including the requirement of staying apart, will not last forever.
It is especially hard right now, but we will get through this. In light of what's happened in our neighboring province, I will end today simply by saying our thoughts and prayers are with all of you. Dr. Russell will now give the COVID-19 update. Thank you. Merci.
Good afternoon. Bon après-midi à vous tous. Aujourd'hui, c'est
Today is a very difficult day. It's full of sadness. And before starting today, I want to add my voice to the Premier and to that of all New Brunswickers in offering my sincerest condolences to the people of Nova Scotia following the senseless and tragic events of this past weekend. All New Brunswickers stand with you at this time of sorrow and heartache. Words cannot adequately express the sadness that we share with you. Today, we are all Nova Scotians.
I want to add my voice to that of the Premier and all other New Brunswickers in offering condolences to the people of Nova Scotia following this senseless and tragic events of this past weekend. All New Brunswickers stand with you in this time of sorrow and heartache, and words cannot adequately express the sadness that we share with you. Today, we are all Nova Scotians. The COVID-19 crisis has enabled us to tap into a deep well of resiliency. It has given us renewed confidence in facing the challenges that will crop up in our lives. This weekend's tragedy will even further test the people of Nova Scotia in these already difficult times. They need and deserve our support, and they will get it. Sharing pain is the theme of a poem called Because We Love, We Cry by Sherry Fitch, an acclaimed children's author. You may know her. She is the sister of the former Chief of Police, Leanne Fitch, and I used to read her books to my kids when they were young. You might remember Mabel Merple and Toes in My Nose, and There Were Monkeys in My Kitchen. So she posted this on Facebook this morning, and I asked her if I could read it to you today, and she phoned me, and I spoke with her, and she said yes, and she would be very happy for me to do that. Because we love, we cry. Sometimes there is no sense to things, my child. Sometimes there is no answer to the questions why. Sometimes things beyond all understanding. Sometimes people die. When it hurts like this, my child, when you are scared, suffering, confused, even if we are not together, let us cry. Remember, there is so much love, and because we love, we cry. Sometimes the sadness takes away your breath. Sometimes the pain seems endless, deep. Sometimes you cannot find the sun. Sometimes you wish you were asleep. When it hurts like this, my child, when you are scared, suffering, confused, even if we are not together let us cry. Remember, there is still so much love. Because we love, we cry. Pray that I had answers, child. Pray this wasn't so. There are impossible things, child, I cannot bear for you to know. When it hurts like this, my child, when you are scared, suffering, confused, even if we are not together let us cry. Yes, there is still so much love. Because we love, we cry. Thank you, Sherry Fitch. I urge every New Brunswicker to reach out to your family, friends, and colleagues in Nova Scotia today. Your kindness will help them bear the weight of the sadness they are now feeling. They need to know they are not alone and that their neighbors are here for them, just as you have been there for your family and your friends in New Brunswick through the current COVID-19 crisis. It is the very least that we can do, and it will mean so very much. Today I have further encouraging COVID-19 news to share with you. There are no new cases to report in New Brunswick. This is the 6th day in the last 10 when we have had no new cases to report. In the past week, there have been just 4 new cases of COVID-19 in New Brunswick. Of the 118 cases confirmed to date, 98 are now considered to have recovered. We still have 20 active cases in this province, and we still have people who are receiving intensive care in our hospitals, so please keep them in your thoughts.
Today, I'm pleased to have encouraging news regarding COVID-19. There are no new cases to report in New Brunswick. This is the 6th day in the last 10 days that we have no new cases to report. In the past week, there have been only 4 new cases of COVID-19. Of the 118 cases confirmed to date, 98 are now considered to have recovered. We still have 20 active cases in this province.
Trend. Fewer new cases are being confirmed, and more people are recovering from their illness. And there is no doubt that this is good news, and we can all share in the success we have achieved to date. But make no mistake, this pandemic is not over, and in this province or anywhere else in the world, we must remain on guard and keep doing what has got us to this stage. That means continuing to stay home, in your own home, as much as you possibly can, keeping your interactions with others brief when you do go out, and it means maintaining 2 meters of physical distance from those you meet. Washing your hands regularly and thoroughly, cleaning thoroughly the frequently touched surfaces of your home, such as doorknobs and countertops. All of these actions are building and strengthening a barrier that the COVID-19 virus cannot cross. The virus cannot move very far on its own. It's people who move and thereby carry the disease to new hosts. To date, the vast majority of New Brunswickers have followed the advice of public health to limit their movements, and this has been crucial in our success as a province. So I really want everybody to understand the importance of what they have been doing and how much it has mattered and how much it has contributed to our success. And so this will be something that will become a recurring theme in all of our lives. And I need everybody to keep that in mind. I know we can't do that forever, and we live in a mobile society where people are accustomed to moving about for education, pleasure, and work. But it is a fact that of life today that many New Brunswickers and New Brunswick families depend on wage that is earned in another province. So many New Brunswickers regularly commute across the country to work in mines, forests, and oil fields in Western Canada. This pattern has been disrupted during the current state of emergency, but we will have to be vigilant to prevent the movement of workers from bringing the COVID-19 virus home with them. So, like all travelers, we expect everyone to continue following the rules around staying home for 14 days when you've traveled outside the province, and that is to protect the province from having any risk of contracting COVID-19. Recently, this has been highlighted by an outbreak that has emerged in Alberta at Carroll Lake north of Fort McMurray. So there have been a dozen cases of COVID-19 reported among workers at that site. So cases have then emerged as a result in British Columbia and Saskatchewan that have been traced back to the people who traveled after working at Carroll Lake. We know that if any New Brunswickers are now or have recently been at this work site, that the information around that has been slow to be transmitted to us. But if there are people who have traveled from that area, obviously anywhere outside of New Brunswick, everyone has to self-isolate for 14 days. It is very, very important. And if you develop symptoms, call 811. De nombreux citoyens de Nouveau-Brunswick font régulièrement la navette d'un bout à l'autre.
So many New Brunswickers traveled across the country to work in the mines, forests, and oil fields of Western Canada. The case of emergency has disrupted this routine. However, we need to be vigilant to prevent that this movement of people brings COVID-19 home with them. A case in point has recently emerged at an oil sands worksite at Carroll Lake, north of Fort McMurray in Alberta. At least a dozen cases of COVID-19 have been reported among workers at this site. Cases have also emerged in British Columbia and Saskatchewan that have been traced back to local people who traveled home after working at Carroll Lake.
Who has recently been outside the province, including Carroll Lake, or has been in direct contact with a person who has recently worked there to immediately self-isolate for 14 days, as per those travel instructions for all New Brunswickers traveling outside the province, and contact 811 for further instructions, especially if you develop symptoms. Even if you feel well and are showing no symptoms, please stay at home for 14 days if you've been outside the province. You can be carrying the virus with you and you can infect others. Until an effective vaccine or other treatment is widely available, we have to remain vigilant. And this pattern of having these types of measures in place and then eventually lifting them may become a recurring theme. And we have to get used to the idea that we may relax measures when numbers are low, and then we may have to re-administer them when numbers get high. So, je vous demande de continuer à faire preuve de patience et en prendre.
I ask you to take all measures to prevent the virus from spreading further in our province. We are not done with COVID-19, and COVID-19 is not done with us.
Continue to be patient and that you continue to do all that you can to deny the virus any chance to take a firmer foothold in our province. We are not done with COVID-19, and COVID-19 is not done with us. Thank you very much.
Thank you, Dr. Russell. Premier Higgs, merci, Monsieur le Premier ministre et Dr. Russell. Nous allons maintenant procéder au...
We will now take questions from the media. You can ask your questions in the official language of your choice.
Questions from the media. You have the right to pose your question in the language of your choice. Andrew Watt, Telegraph-Journal.
Thanks, Bruce. My question is to the Premier. Premier Hicks, first of all, can you share a bit more of your conversation with Premier McNeil about what happened in Nova Scotia on the weekend?
Well, Andrew, it wasn't a conversation as such. I connected with him in the morning, mid-morning, on Sunday morning in relation to what I was hearing and what I'd gotten report from my officials. and then we corresponded back and forth on as a text message. I offered my obviously my condolences, and I offered any support that we could provide, and of course I'm well aware that our officers, the RCMP particularly, were working hand in hand with the detachments in Nova Scotia, and we're working with the case together.
Thank you. Andrew, do you have a follow-up question today?
I do, thank you, Bruce. Again, to the Premier. Premier, so last week you sort of talked about, if these good numbers, no new cases or very few cases trend continues, that you would be looking at potentially, at the start of May, maybe being an opening point. Your confidence must be growing, I'm assuming?
Well, certainly every day that has minimal cases or no cases is a great day in that sense. We will work continually with Dr. Russell and her team to ensure that any changes we make would reflect the ability for us to maintain the public health rules and regulations in order to make those changes. Yes, the fact that we are continuing to receive positive results would reinforce our idea to look at getting back to a new norm, whatever that will be, but it'll be different than what we're used to. Also looking at the economic recovery side, and then trying to balance this as we reintegrate into society. I, like everyone else in the province, is feeling a need to start to have a change, and I just want to say how appreciative I am of how the citizens of this province have reacted to follow the rules, to stay very focused on protecting each other, protecting their families, and working diligently for us to fight this on one front. And those efforts are certainly bearing positive results, and which ultimately we would hope would allow us to make some positive changes in the coming days and weeks as we had hoped.
Thank you. Vicki Hogarth, Charlotte County TV.
Thanks, Bruce. Question is for the Premier. I understand from speaking to local RCMP that mostly warnings are being given out for people who aren't social distancing, but the odd ticket is still being handed out for blatant non-compliance, such as cars full of friends. Can you provide us with the latest update on how many fines have been given out to individuals who aren't practicing social distancing?
Actually, I do not know the exact number. I think we had 26 of last week, and I can get an update on that and certainly provide that to you or have it for you tomorrow. But certainly our safety and compliance officers and our policemen are authorized to look for and question individuals that obviously are more than a family outing, but more of a social gathering in vehicles, because that is when we kind of let our guard down, the biggest opportunity or potential is that we quickly return to a normal way of life, that we're not really ready for that, and we won't be really ready for it as a normal way of life until we have a vaccine. So I can get you that exact number, but I do not have it today.
Thank you. Vicki, would you have a follow-up today?
I do, thank you, Bruce. My follow-up's for the Premier as well. It's been reported that there was a surge in gun and ammo sales in places like Macadam in March before the lockdown became seriously in effect. How do you respond to people who might be nervous about this fact in relation to the tragedy this past weekend?
Well, I can't certainly confirm any resurgence. That has not been reported to me that has been a reality or not. So. And I guess what I would say is that according to the reports that I've received on this tragic event in Nova Scotia, and it was reported, certainly yesterday by the police officials in charge, that this was an event that was some time in the planning, because of certainly obviously the car that was marked up was brought into the as an example that this was not happened because of any recent situation in relation to COVID, but more so in a planned event that was, I guess, pending.
Thank you, Premier.
Thank you. Gail Harding, CBC.
This is for Premier Higgs. A lot of surgeries were canceled to prepare for the onslaught of COVID-19 cases, but only 13 people have been admitted to the hospitals for COVID. Why couldn't some of the more serious surgeries or surgeries that would relieve some people of great pain have continued, even if it was at a reduced rate?
Well, I think initially, and Dr. Russell may want to speak to this as well, initially the plan, and as we were working with the public health, was to make sure that we had adequate capability within our hospitals. And so it's too late to wait for that. You need to make sure that you're ready to deal with what we were seeing from other countries, other provinces. And so, while it is wonderful news that we haven't seen the COVID outbreak here, like as many of our neighbors and many other countries have, we wanted to be ready, and we still must be ready. But I do think your point of now looking at, can we start to look at elective surgeries? Can we start to open up some hospitals? And can we start to get back in business? Because it's still a concern. People home who have an illness, who feel uncomfortable coming to the hospital, or they have been postponed their surgery. So as part of the recovery plan, it's not all about economics. It's about restoring our healthcare system back to its original self and better. As we've learned through this process, but it's very much a focus for us to get back into the healthcare business over and above COVID.
Dr. Russell's coming to the podium, Gail.
Thank you.
Yeah, so we definitely wanted to be prepared for the worst case scenario. As we'd seen in other jurisdictions, when they quickly became overwhelmed, it was too late to act then. So we wanted to be extremely proactive and make those hard decisions. As difficult as they were, those were not easy decisions to make, and we worked very closely with the regional health authorities on that to really identify what was the bare minimum that we would need to continue functioning within the hospital, knowing that, again, if we had an increase in numbers very suddenly, that we would need a lot of space in the hospital system, and we needed to protect people who didn't already have COVID-19 from being exposed. So part of the recovery plan that we have in terms of the next phases of the response, we will make sure that, again, the triggers are being discussed at the national level in terms of when to release measures, and the triggers of when to put measures back in place are being developed at the national level, and we are incorporating that into our provincial approach. So we will make sure that we have those conversations and make sure that we get things up and running as soon as we can, with all of those pieces of information in mind, knowing that, again, this will be a cyclical event whereby, again, because we can't change what's happening outside of our borders, our neighbors are still struggling with their numbers and probably will continue to struggle for a while. So as long as we are bordering on neighboring jurisdictions that have case counts that are increasing, we have to stay vigilant, and we have to be prepared for releasing measures and then imposing them again on very short notice. So we are going to be doing a dance, basically, where we lift measures and we put them back in place based on data and based on criteria that is being established at the national level around case counts and the types of cases that we see in a province and the time frame around when we stop seeing an increase in numbers.
Gail, do you have a follow-up today?
Yes, and this can be answered either by the Premier or Dr. Russell. There will be a lot of surgeries that are going to have to be rescheduled. Does the government have a plan to avoid a logjam of those?
Today, we're working with the Department of Health, working with the medical societies as we put together a schedule, understanding, what is the backlog. I guess what I'm hopeful, we've seen a lot of great changes in the system, I guess, in ways of getting things done that would have taken weeks and months and even years that have been accomplished in the last five weeks. So I am encouraged by that and optimistic that we can see that same sort of efficiency and improvements and reaction to getting back up and running as we can, based on what we can work through with public health as a safe and way to return to service, but do it in a way that is maybe certainly more proactive and can be accomplished in a much faster pace as we've seen. I think the last thing that we want to do is just simply, have the hospitals fill back up and people wait for surgery. Let's try to make that so we can schedule it in advance. We can have people moving through the system. I know we're looking at it in other areas. The court system changes that have been made, in doctor's appointment changes have been made. So can we have a better scheduling opportunity and be proactive in how we manage to get people in and out of hospital for their surgeries as quickly as possible?
Michel Corriveau, Radio-Canada.
Michel Corriveau, Radio-Canada. Thank you, Bruce. I have a question for Dr. Russell. The predictions that you shared a few weeks ago, the 500 to 1,700 cases, will that change, considering that there have been little to no cases in the last week? Answer. The number of 500 to 1,700 was the predicted number of deaths that we could expect in the next 2 years. So these projections were for the entire duration of the pandemic. Michel, do you have any follow-up question? I would like a clarification. So what you're saying is that you're not reducing your projected numbers. I'm asking if the projections that were made will be revised, considering that we have had so few cases. Answer. It is very difficult to predict because there is an increase of cases outside of New Brunswick. This means that anyone that leaves New Brunswick risks bringing COVID-19 back here. So as cases come into the province, if they're not completely isolated, it means that the people of New Brunswick will continue to be at risk of increased cases, of a sudden increase of cases at any time. So over the next 18 to 24 months, until we have a vaccine, this is how we are going to live here in New Brunswick. When the numbers are low, we can change the measures that are in place. And as numbers increase, we'll have to put the measures back in place. We are identifying all of the criteria at the national level that will inform our decisions. Epidemiologists will dictate how and when we change our measures. Mr. Corriveau, do you have a follow-up? I have a question for the Premier. You said that we could have lifted restrictions starting in May. If businesses that are currently closed had to open, would there be changes in childcare that would allow workers to go back to work? And what would that look like?
So, very good question, and certainly we would be coordinating that as a requirement prior to making the moves and what businesses would open, because we recognize that many families right now are at home, and if the family members were back to work, then there could be a need for additional childcare spaces. So that'll be part of the consideration as we look across society, as we look across the province, and in what areas of startup, then what are the individual considerations, and do we have the requirements? So it is part of the analysis of how we start up.
Thank you. Let's see. Silas Brown, Global TV.
Hi, Premier. I know that you alluded to the tight bond between Nova Scotia and New Brunswick in your opening remarks, but I'm wondering what you have to say to New Brunswickers who have been impacted by this tragedy that happened yesterday who are unable to cross the border to see their loved ones and offer their condolences or even spend time with their loved ones within the province. What do you have to say to those people?
Well, it's a devastating tragedy that's been made even worse by this health concerns that we have now in our respective provinces. So I know that it's tough, and I just ask that people respect the health rules that we have in place for our own protection, but reach out to their family and friends in whether they be in New Brunswick or they be in Nova Scotia. Reach out in other ways, and we can certainly do that online. We can have the interconnections without the physical connections. But it is really tough, but it has to be handled in a different way, because we can't lose sight of why we have these public health measures in place, and we can't lose sight of the emotion and the tragedy that affects every one of us, whether it happened in Nova Scotia or whether it happened elsewhere. This is an immeasurable loss in our respective community and in our a neighboring province in this case, and we all are devastated by it.
Thank you. Silas, do you have a follow-up today?
Yes, one for Dr. Russell. You spoke about the potentially cyclical nature of easing and then re-implementing restrictions. What would be some of the triggers for that? And would, as you kind of ease and implement restrictions, would that be based, regionally if there were flare-ups or that sort of thing, or would things still kind of be cross-country? Maybe this is also one for the Premier as well.
So at the national level, through the Special Advisory Committee, which is made up of the Chief Medical Officers of Health from across the country, as well as the Chief Public Health Officer and Deputy Chief Public Health Officer for the country, the criteria in terms of the data that we will use is going to be consistent across the country, but how each province applies it will depend on their individual data and their individual number of cases, et cetera, and the type of transmission. So if you break it down into jurisdictions, then within each jurisdiction, if we need to make changes according to areas that need different types of measures applied, we can definitely have those conversations. I think right now we're trying to nail down a consistent framework so that we are all singing from the same songbook. And that way, when we do apply those measures individually in each province, then we can have our own discussions around what that looks like at a provincial level and then at a regional level.
Thank you. Laura Brown, CTV.
Good afternoon, everyone. Premier, I'm wondering if you could tell us whether or not the border closure would be one of the last restrictions or measures to be lifted, like in the sense of off to the lower end of things with the borders be the last thing to kind of open up?
I would say at this time, yes, indeed. Certainly, if we see the level of concern and the health risks around us, it would not be prudent for us to change the regulations around our borders. However, we'll work with public health to come up with the right solution there, but I would say, yes, indeed, it would be one of the last things that would change.
Thank you. Laura, do you have a follow-up this afternoon?
Yeah, and on that, so is there going to be other plans in place for the tourism sector here in the province? Are you going to be encouraging, I guess, more New Brunswickers to help tourism operators get through this time when they can't count on out-of-province visitors?
Yes, indeed. I think that in this situation, this is a time to discover New Brunswick once again. So once we are able to, and hopefully that will be soon, to allow more movement throughout the province, we want to have people be staying in New Brunswick. And I guess we've heard the term many times about a staycation, where we have our own people traveling throughout New Brunswick and not traveling outside. Because at this stage, any outside travel would require a quarantine coming back into the province. And we'll We'll look at that, or self-isolation. We'll look at that as time goes on, but I would say people should be looking at New Brunswick once again.
Thank you, Laura. Matthew Wacomo, l'Acadie Nouvelle.
Matthew Roy Como, Acadie Nouvelle. My question is for Dr. Russell. As there are increasing days with no new cases, and we are able to do so much more testing, are we still far off from a point where we would start testing people who don't have any symptoms? When will we start doing this? Answer, no, that reality is not far off. But it's something we would do among specific populations. For example, high-risk populations. These are discussions that we are having now. Our plans will follow our discussions, and I'm hoping that it will be soon. Question. Can you clarify what constitutes an at-risk population? And can you also tell us how things are going with telecare? Is there still a high volume of calls? Answer. The report from 811 this morning is that the call volume is still high. The percentage of people who are referred for testing has increased because of the expansion of our testing criteria. They received 200 calls, and of the 200 calls, they sent most of them to testing centers. So that's the first part of your question. With regards to high-risk populations, we have a working group that has identified all vulnerable groups. There are directives and documents that ensure that the risks that are identified with vulnerable populations have been addressed. If more work needs to be done among these populations, we have the capacity to do it. So among these vulnerable groups, it is because of increased risk. So they would be the first to be tested even without symptoms. These are people who are in care homes, people who are homeless or who are living in shelters, or people who are incarcerated. Other high-risk populations include people who have more health concerns. So we would start testing people who live with them. Charles Camiran, TVA Edmundston. Thank you, Bruce. My question is for the Premier. In the last version of the emergency measures declaration, you state that it is forbidden for property owners to allow people to come in to their land if they can't respect the social distancing. For example, animal grooming centers. If a client brings an animal to the entrance of the shop, can that shop open? How would that work for this specific situation?
So going forward, over the coming days and weeks, we're going to be looking at specific cases of being able to open up, and I mean that would be one case. What would that entail? And if that operation can verify and validate that they can provide a safe operation that respects social distancing, then our goal would be that we would allow them to start up operations. But I think that what we want to do is basically identify different businesses, but more so identify the requirements to return to operation. And then the onus is on the individual operator to meet the guidelines, and they will be monitored and enforced, but that they would come up with a procedure that could be approved that say, here's how I can run my business and meet the public health requirements. And we'll be providing, that sort of, path forward in the coming weeks and months, or days and weeks, I should say. And the idea is that we want to be sure that the onus is on the individual to meet the standards, because the options in not doing so would be a fine or certainly a closure or shutdown. We just cannot allow any option, to loosen our current situation that would be to our detriment, and we see an increase of cases, because it can start so quickly if we don't all continue to exercise good behavior.
Thank you. Monsieur Cameron, as-tu suivi cet après-midi?
Monsieur Camiran, do you have a follow-up? Yes, my follow-up is for the Premier. Last week, you said it would not be impossible to offer a salary increase for workers in the essential workers. My question is this: have you decided whether or not there would be salary increases for care home workers? Have you made a decision at this point, or are you still thinking about it?
Well, it isn't necessarily a simple case of me thinking about it. It's a case of understanding what are the rules around what the federal government had put in place. So at this stage, we are trying to determine exactly what's the criteria. But what criteria that they have given us is not so much in the definition of the essential workers, because we can all have different definitions, and we certainly know that the healthcare workers and the whether it be in the nursing homes or the hospitals or special care homes or any type, as well as truck drivers, as well as many others, would be essential services. What the federal government has proposed is that their consideration is for anyone earning less than $2,500 a month. So what we're doing is we're trying to get clarification on their definition of an essential worker, and also we're looking across the spectrum to see how many essential workers that we will determine would qualify for their compensation.
Merci, thank you. Merci, Monsieur Cameron. Jacques Poitras, CBC.
Hi, Premier. You've said that the surplus is gone for this year. On Friday, David Coons said that he thinks there needs to be this higher level of spending for the long term to support workers and businesses. How willing are you to look at a deficit for a second year, and what will it look like to get out of the deficit?
Well, firstly, I don't think we can make any let's say a statement that we should look at a higher level of expenditure. It should be, what is that expenditure going to achieve in relation to what it means for the long haul for New Brunswick citizens? So in other words, are we going to be able to fund the absolute necessary services? Are citizens of the province, are they ultimately, would they be satisfied with paying more taxes? If we have a reduction in our transfer payments, and one would certainly be concerned about that, given the fact that some of the major sources of revenue into the federal government have essentially dried up. And so what does that mean for the long haul? So I think this has to be a very balanced approach, and I'm eager to entertain that discussion with not only the leader of the Green Party, but the leader of the Liberal Party and the leader of the People's Alliance on about the long haul strategy. because any decision we make is about the long haul. So, you know, it's like, are we in a process here of recovery, or are we going to just simply put the Band-Aid on for today and not worry about tomorrow? And I think that anyone who knows me by now would recognize that I don't like making decisions for just today. I like to make a decision that's based on how we see the future of our citizens continue to prosper and move back to a new norm, as we've talked about, but do it in a way that is sustainable and they can find employment and that we can find a path forward over the coming years. And that'll be my goal, and I'm sure Mr. Kuhn would want to look beyond just today and look for tomorrow as well.
Thank you, Premier. Jacques, would you have a follow-up today?
Yes, thank you. You and Mr. Kuhn have both also talked about New Brunswick being exposed to disruptions in the global supply chain, how that's become evident. You know, trade is a two-way street, and if we pull back from importing as much, I wonder what will happen in terms of reciprocal agreements to our ability to export our products.
Well, that's absolutely right. It is a concern in both ways. So how do we look at sectors? And we had this discussion last week about food security. And if we can ramp up our ability, let's say, to grow more here in the province and have a greater level of food security, then let's start down that path. Because, you know, of the old adage, you just don't, you know, cut your nose off, spite your face, so to speak. You know, when you absolutely need to know where you're going and you build up that capability before you find out I don't have a backup. So today, and I know we had a very good discussion on food security, and we're all in agreement that, you know, one thing we have here in this province is we have many things, but one thing is certainly lots of land, and we need to make better use of it. So we can start to reduce our dependence, but it's, again, not something that you can do overnight. It's something that you build some clear line targets. And for me, as part of, I guess, what I've said a few times here, part of our ability right now that is unique is we have got, you know, working our way through a health crisis, and we're working in a way through this in nonpartisan fashion. And that's exciting. We need to build our economic recovery in the same nonpartisan fashion, so it will continue to get better year over year, and it won't be dependent on the election cycle.
Thank you, Premier. Thank you, Jacques. Did I miss anybody this afternoon? Voilà la fin de notre mise à jour. Merci beaucoup.
This is the end of today's update.
Today's update. Thank you very much, everyone.